Hi everyone, this is Carly over at Green Dental Care. I'm one of the hygienists here. I'm just going to be explaining periodontal disease, perio maintenance, and deep cleanings today. So when you come in for your new patient appointment, what we normally do is we take a full set of x-rays and we get some gum measurements. So the gum measurements are to determine what kind of cleaning that you need. So what we do is we kind of measure from the gums to the bone level here. So like this is a healthy picture. Gum measurements, healthy measurements are normally between 1 to 3 millimeters. When you pop over here, you can see that, the measuring tool goes down into the gums a little more and the bone level's a little bit lower than over here. So when we see 4 millimeter pockets, we're looking at gingivitis, so a little gum inflammation. And when we see 5s and above, we're looking at like bone loss and periodontal disease. So these are healthy gums over here. You can see how they're pink and nice. Over here they're unhealthy, red, kind of swollen, with some buildup it looks like. What we're looking at here is some bone loss. So that's really what we're taking a peek at when we do those gum measurements. We can also use the x-rays here to take a peek at the bone levels as well. This right here is some unhealthy bone. You kind of see there's quite a bit of bone loss. What we normally like to see is the bone levels coming up and kind of curving up a little closer to this top line here. We also want to take a peek at something like this to see if there's any buildup that's underneath the gum line. So there's kind of some spurs that come off the teeth here that we're looking for, just to take a peek. When we see this kind of thing in bone loss, and pockets that are above 5 millimeters, we do what's called scaling and root planing, or a deep cleaning we call it. We normally do one side and then the other. We get you numb, go underneath the gums, get it, bacteria build up, all that fun stuff cleaned out. We use a water tool, hand instruments, sometimes even a laser to get the gums back to a healthy state and prevent bone loss. So with this deep cleaning, you're not going to gain any bone back, but you don't want to have any more be lost because, obviously without the bone, you won't have your teeth being held in. So after this, to just kind of keep up with the maintenance cycle, we do what's called a perio maintenance cleaning. So after the deep cleaning, we have you come in 3 months after or so, and most patients normally come in every 3 to 4 months once they get the deep cleaning. So they get 3 to 4 cleanings a year, and they do the maintenance cleaning. So we'll check the gum measurements again. We get underneath in the pockets every time you come in for the maintenance cleaning. We don't get you numb, but we still clean out under there because our toothbrush and floss and stuff can only get down 2 to 3 millimeters in the pockets. So the hope after the deep cleaning is that the pockets will, lessen, but if you're at a 6, it's not going to probably lessen to a 3 right away by any means. So we still have to do those maintenance appointments, get underneath the gum line. So it is different than a regular cleaning. Regular cleanings stay above the gum line / go underneath like 1 to 2 millimeters just to get everything cleaned out. So yeah, if there's any questions, just feel free to give us a call and we look forward to talking to you soon.